In essence, healthcare is the method by which obtaining medical care is organized. In the case of this video, however, we'll be focusing specifically on the healthcare system in the United States. The current healthcare system in the US is actually quite unique among industrialized nations in that most of the healthcare is provided privately, whether that be through one's own funds via an insurance company or through an employer. Roughly 37% of those insured, however, receive their coverage through US government entitlement programs such as Medicare and Medicaid. So now that we know what healthcare is, it begs the question, why is healthcare an issue? Well, because the healthcare industry in the United States is mostly privatized, obtaining access to healthcare through health insurance is often too much of a financial burden on many Americans who do not receive assistance from their occupation and must pay individually. Although, as stated before, the national government does provide entitlement programs such as Medicaid and Medicare, not all Americans are eligible for them given their requirements / are even aware that such programs exist. In a census from 2018, an estimated 28.5 million Americans were said to be without any health insurance. Furthermore, for those who are insured, several factors such as technological advancements and rise of chronic diseases have led to rapidly increasing prices. Family coverage health insurance plans have increased roughly 61% in the past 10 years and are estimated to keep rising. The moral of the story is that healthcare is beginning to become more unaffordable for millions of Americans, healthcare that ensures medical assistance whenever it is needed. A few things have already been done in order to combat the increasing healthcare costs. Under the Obama administration, Congress passed the Affordable Care Act. Through this act, the Obama administration hoped to lower the cost of health insurance to those with incomes in a margin around the federal poverty level, increase the coverage of Medicaid, and generally lower the cost of healthcare through sponsoring innovation. Although this act was successful to some degree in extending healthcare coverage in the United States, critics to this act argue that the act was a failure for reasons such as its inability to help middle-class Americans and negative impact it had on employer-provided healthcare. So what about now? Despite actions to combat the rising prices of healthcare, it is apparent that many feel that more needs to be done. Making recent headlines, some believe the best way to combat the healthcare crisis is to implement a universal healthcare system in the United States in which the national government has control of all healthcare. Also known as a single-payer healthcare program, or as coined by Senator Bernie Sanders, Medicare for All, such a change would involve the national government as a central organizer of all healthcare financing, with actual care still delivered privately. Most importantly, however, under the system, all U.S. residents would be covered for their medical necessities, from doctor's visits to long-term care to prescription and dental costs. To fund such an endeavor, current programs in place for public funding, such as Medicare and Medicaid, would be combined along with new income taxes. Supporters of Medicare for All see healthcare as a basic right that all Americans deserve. With the price of health insurance increasing rapidly in recent years, they believe that having a government-controlled system of healthcare would be able to reduce costs extremely significantly. By ensuring that everyone is able to afford healthcare, public health in general improves, which could further lead to a better economy if more members of the workforce are healthy. They also see this as an opportunity to reduce inequality throughout the nation, both in regards to the health of citizens and in closing the wealth gap. Finally, the United States would not be the first country to adopt such a system. Other nations, such as Canada, have a similar system that has already been working efficiently to provide healthcare for their nation. On the other side of the argument, however, some people see the effects of a universal healthcare system as disastrous. For one, they believe that preventing the privatization of the healthcare system also prevents competition in the industry, which negatively impacts the economy. Healthcare experimentation in order to find the best approach would also fade. Such a plan would also be extremely costly. To make up for the costs, which would cost nearly $32.6 trillion over a 10-year period, taxes on citizens would have to rise. They are skeptical of the fact that if individuals would have to pay significantly less or nothing out of their own money, then why wouldn't people be able to abuse the system by overusing the services such a system would provide? Others compare a system like this to socialism, fearing that complete equality for all through government intervention is dangerous. And thus the question arises, what do you think about the universal healthcare plan? Is it a good idea? Is it a bad idea? Why don't you let me know in the comment box down below. While you're down there, feel free to drop a like on this video and subscribe for yearly government projects.